Diego Mayor Todd Gloria just announced a coordinated effort with law enforcement agencies. CBS 8's Kelly Hessedall was there when this announcement was made. Joining us live now with those details. Kelly?
Well, that's right. You know, federal authorities say San Diego is considered ground zero for smuggling fentanyl because of our proximity to the border. They say the crisis has gotten so bad. The mayor says he's issuing an executive order telling his staff that this is a top priority.
We will not make or accept excuses for letting this crisis continue to grow out of control. We're going to own this, and we're going to make sure that we're tackling it at every level, local, state, and federal. We'll get started. Good morning, everybody.
And Mayor Gloria was joined by several law enforcement agencies today. The DEA, the U.S. Attorney's Office, San Diego Police, the Sheriff's Department, the Fire Department, who say the fentanyl crisis has gotten so out of control that it's an all-hands-on-deck situation. Now, just to give you an idea, in 2021, there were 812 fentanyl-related overdose deaths in the county. And this year, the county surpassed that number in just the first 6 months. So the mayor says one of the big things they'll be doing is dedicating more resources to street-level enforcement and investigation, and also drafting policies and legislation to make sure nothing is standing in the way of law enforcement and the district attorney's office from arresting and prosecuting dealers, and to also try and enhance penalties for dealers at a state level who provide fentanyl that results in death. Now, authorities say this is something that is affecting people from all walks of life. Mayor Gloria says dealers are preying on the homeless population. The DEA says kids are getting a hold of fentanyl-laced pills from social media, and they're getting it from their friends at school. Here's DEA Special Agent in Charge, Shelley Howe.
I just sat down with a mother yesterday for 2 hours that lost her son from taking half of a pill. She's beating herself up, right? There's nothing else she could have done. There was no prior drug use. It was half of a pill to help her son with anxiety. She had appointments scheduled to get it from a psychiatrist, but he wanted to self-medicate. Half of a pill, and he is gone.
And so she says you really have to have those tough conversations with your kids. She says the bottom line is you have to assume anything that doesn't come from a doctor is laced with fentanyl. Kelly Hessedall, CBS 8.